This is the video on referred pain. Pain input follows distinct pathways from the skin, following the dermatomes. Pain from the internal organs do not have a distinct pathway and can cause confusion for the brain. If you hurt your elbow, the pain fibers from the elbow go to the spinal cord and enter around the level of C7. This is a common injury, and the brain knows that pain coming from this spinal level is from the elbow. In fact, the brain is pretty specific about where the pain is originating, pinpointing it exactly. Most of us, hopefully, have not experienced pain from the heart, such as when a person is having a heart attack. This pain is coming from a new source. The pain fibers enter through the C7 level of the spinal cord on the left and through the vagus nerve. The brain has not felt this pain before, so it assumes that it is coming from the left arm. But it also knows there is something different about the pain. Therefore, the brain is not too specific about where the pain is located. The pain is throughout the upper arm mostly, and is nebulous as to the exact origin of the pain. This is known as referred pain. A person having a heart attack might not know that this is what's happening. They think there's pain in the left arm for some reason. They can hold the arm close to the body, cradle it, put ice or heat on it, or any other type of pain-reducing behaviors, but the pain does not go away. This is because the pain is not coming from the arm, it's coming from the heart. Pain from the heart is called angina. If a person has chronic angina, the brain learns that it is coming from the heart and the arm pain no longer occurs. The person now feels the pain in their chest. Other internal organs have referred pain. If you have reflux of stomach acid into the esophagus, this will be felt as chest pain. Numerous people have gone to the emergency room thinking they're having a heart attack when they are actually suffering from reflux. Once the person experiences reflux a few times, the brain will learn that those pain fibers come from the esophagus, and the pain will then be felt there instead. This happens with gallstones, kidney stones, urinary tract infections, prostatitis, and even after laparoscopic surgery. During laparoscopic surgery, gas is used to inflate the abdominal wall for better visualization of the organs. If the gas is not completely removed, it can move around in the abdomen. When the person stands or sits, the gas moves upward toward the diaphragm, extending the diaphragm. This causes painful stimuli to the diaphragm. The pain will be felt in the scapula. Nothing tends to help the scapular pain since it is not originating from there. The best method to reduce the pain is to lie down with the pelvis elevated. The air will move to the pelvis and away from the diaphragm, thus no more pain. Laparoscopic surgeries have gotten better, and this is not such a problem as it was in the past. Interestingly, the brain itself has no pain fibers. A surgeon can operate on the brain while the person is still awake. In fact, some surgeries require that the patient be awake, as in deep brain stimulator placement. Once the scalp, skull, and meninges are opened, there is no pain cutting into or placing a probe into the brain. This ends the video on referred pain.